Hi, my name is John Kiragu, and today I want us to dive into a very important issue, very important lessons we can draw from the application of international health regulations during COVID-19 pandemic. Let's break it down. During COVID-19 pandemic, international health regulations came in handy because the regulations required that countries implement evidence-based interventions in response to COVID-19 pandemic, and this was crucial globally and even in Africa. And the international health regulations further required a unified response to COVID-19 pandemic. However, implementation of international health regulations has not been consistent across World Health Organization member states. And in Africa, this was evident during COVID-19 pandemic, whereby countries adopted varying public health response measures that created diplomatic strains and rows, and we are calling a patchwork of public health measures that contributed to disparities in COVID-19 response in low resource settings such as in Africa. The East African community had an intention of having a unified response to COVID-19 pandemic. However, it was very evident that member states or EAC members had the flexibility to opt out of this unified approach or regional response to COVID-19 pandemic. And this also underscores the flexibility of the current international health regulation measures, the flexibility for member states to opt out. Now, these are the key lessons that we can draw from that situation. Number one, revision of international health regulations to make them more enforceable. And we can draw our inspiration from the Convention for Tobacco Control, which has been shown to be more robust in enhancing compliance to health goals. So we need something similar for international health regulations to make them much more robust in future health emergencies. Second lesson, we need to implement population connectivity across border, POPCAB framework. So this framework has been shown to enhance identification of high-risk areas along the border and to enhance cooperation and collaboration for cross-border surveillance and disease prevention measures. So we'll need to adopt that kind of a framework in our cross-border response to pandemics. Number three, we need timely reporting of pandemic data or data from public health emergencies. This is critical because when we have timely reporting of data, for example, to globally recognized body responsible for coordination of global health emergencies, we will have timely response, timely containment of public health emergencies before they grow out of proportion and before they outstrip our capacity and our resources to be able to contain it. In summary, regional frameworks for pandemic response, such as the East African community, and even a framework such as the international health regulations, are critical to help us prepare and respond better and do better in public health emergencies. However, those frameworks need to evolve to be able to respond to emerging public health emergencies more efficiently and more robustly. And finally, preparedness is the best way to remain protected from global health insecurity. I would love to hear your thoughts about this topic. Thank you very much.